Questions and answer words for paramedical examinations in Viva. 1. Give an example of an acute effect of radiation exposure. A. Headache. B. Leg pain. C. Dermatitis. D. Conjunctivitis. Answer. A. 2. Dosimeter is used to assess the absorbed rate of A. Light. B. Heat. C. Radiation. D. Steam. Answer. C. 3. What is the adequate distance between machine and control panel in a radiation room? A. 4 meter. B. 3 meter. C. 5 meter. D. 6 meter. Answer. B. 4. Angiographies are performed for visualizing A. Heart. B. Lungs. C. Stomach. D. Blood vessels. Answer. D. 5. From which Latin word the term ambulance was developed? A. Ambier. B. Ambulare. C. Ambulary. D. Ambulary. Answer. B. 6. Which type of cold chambers are used in forensic institutes? A. Negative temperature. B. Positive temperature. C. Cold temperature. D. Freezing temperature. Answer. A. 7. Which department is responsible for the quality and quantity of food supplied in hospital? A. Nursing. B. Administration. C. Finance. D. Inpatient catering. Answer. D. 8. Dash is a treatment that filters and purifies the blood using a machine. A. Fluoroscopy. B. Angiography. C. Dialysis. D. Echocardiogram. Answer. C. 9. Expand MDT. A. Mobility data terminal. B. Mobile data terminal. C. Mobile data term. D. Mobile dial terminal. Answer. B. 10. Which functional type of an ambulance is known as the fly car? A. Van. B. Bus. C. Car. D. Response unit. Answer. D. 11. Which type of dialysis is also called as hemofiltration? A. CRRT. B. IPD. C. CAPD. D. CCPD. Answer. A. 12. What is the color code for recyclable non-infected general waste? A. Yellow. B. Red. C. Black. D. White. Answer. D. 13. Is a machine that helps a patient to breathe when he or she is recovering from surgery or critical illness or cannot breathe on his or her own for any reason. A. Mechanical ventilator. B. Pulse oximeter. C. Oxygen mask. D. BP apparatus. Answer. A. 14. Dash is defined as the act of managing nursing duties, responsibilities or rules. A. Nursing in charge. B. Nursing supervisor. C. Staff nurse. D. Nursing administration. Answer. D. 15. Expand MSDS. A. Material safety data sheet. B. Method safety data sheet. C. Machine safety data sheet. D. Methodological safety data sheet. Answer. A. 16. Which type of infection is also known as nosocomial infections? A. Nose infection. B. Eye infection. C. Hospital-associated infection. D. Conjunctivitis. Answer. C. 17. Expand PPE. A. Personal protective equipment. B. Personal proactive equipments. C. Personal protection equipments. D. Personalized protection equipments. Answer. A. 18. Who is the second command in the nursing department in a hospital? A. Nursing supervisor. B. Nursing in charge. C. Nursing superintendent. D. Nursing director. Answer. C. 19. In microorganism spillage, final cleaning is carried out using A. 50% alcohol. B. 40% alcohol. C. 60% alcohol. D. 70% alcohol. Answer. D. 20. What is the color code used for soiled waste? A. Red. B. White. C. Yellow. D. Green. Answer. C. 21. What is the duration of storage of biomedical waste in a hospital? A. 10 to 12 hours. B. 8 to 10 hours. C. 12 to 24 hours. D. 2 to 8 hours. Answer. B. 22. Dash is the process of converting waste products into new 23. Is a method in which solid wastes are burned at high 22. Dash is the process of converting waste products into new product. A. Recycling. B. Waste collection. C. Segregation. D. Color coding. Answer. A. 23. Is a method in which solid wastes are burned at high temperature. A. Deep burial. B. Land filling. C. Incineration. D. Chemical treatment. Answer. C. 24. Which method of biomedical waste management involves excavation of the waste trench? A. Incineration. B. Chemical treatment. C. Mechanical treatment. D. Landfill. Answer. D. 25. Human anatomical wastes are disposed by using A. Chemical treatment. B. Incineration. C. Landfill. D. Mechanical treatment. Answer. B. 26. Which method of disposal is used for incinerated ash? A. Landfill. B. Chemical treatment. C. Mechanical treatment. D. Incineration. Answer. A. 27. What is the meaning of suffix megali? Removal of. Enlargement of. Tumor. Disease. Answer. B. 28. Expand PFT. A. Pulmofunction test. B. Pulmonary test. C. Pulmonary function test. D. Pulmonary function test. Answer. C. 29. Expand EMG. A. Electrified myography. B. Electrophyomyography. C. Electromyography. D. Electriomyography. Answer. C. 30. Dash is a portable apparatus used for aspirating fluids from a person's airway and mouth. A. BP apparatus. B. Suctioning machine. C. PFT. D. EMG. Answer. B. 31. Crash cart is also known as A. Call cart. B. Code-in cart. C. Code cart. D. Called cart. Answer. C. 32. Ellipsis dot is used to inflate or suspend tissues during surgery. A. Oxygen. B. Carbon monoxide. C. Carbon dioxide. D. Hydrogen. Answer. C. 33. Dash is a device that shows the electrical and pressure waveforms of the cardiovascular system. A. BP apparatus. B. Holter monitor. C. Cardiac monitor. D. Centrifuge. Answer. C. 34. What is the meaning of prefix my-o? A. Pertaining to muscle. B. Pertaining to eyes. C. Pertaining to bone. D. Pertaining to head. Answer. A. 35. What is the name of the equipment which is used for the separation of fluids, gases or liquids based on their density? A. Thermometer. B. BP apparatus. C. Centrifuge. D. Holter monitor. Answer. C. 36. Ophthalmoscope is also called as A. Laryngoscope. B. Myoscope. C. Fundoscope. D. Orangioscope. Answer. C. 37. Dash. Test is used to detect neuromuscular abnormalities. A. ETG. B. ERG. C. EEG. D. EMG. Answer. D. 38. Expand CT scan. A. Continuous tomography. B. Computerized tomography. C. Calciferous tomography. D. Continuous topography. Answer. B. 39. What is the meaning of the prefix a? I. B. Present. C. Abdomen. D. Without. Answer. D. 40. Which of the following is not a direct care provided by a nurse? A. Feeding. B. Treatment. C. Mobility. D. Reporting. Answer. D. 41. Which of the following is not an indirect care provided by a nurse? A. Feeding. B. Reporting. C. Recording. D. Discharge planning. Answer. A. 42. Training provided to new employees by employer is called a. Job orientation. B. In-service education. C. Continuing education. D. Induction training. Answer. D. 43. Who is the head of the nursing department? A. Nursing supervisor. B. Nursing superintendent. C. Nursing director. D. Medical superintendent. Answer. C. 44. Who is responsible for budgeting and record keeping of nursing department? A. Nursing supervisor. B. Nursing superintendent. C. Nursing director. D. Medical superintendent. Answer. C. 45. Who is responsible for arranging meetings for nursing staff periodically? A. Nursing supervisor. B. Nursing superintendent. C. Nursing director. D. Medical superintendent. Answer. B. 46. Which device regulates and measures the flow of a fluid and gas? A. Crash cart. B. Suctioning machine. C. Flow meter. D. Stethoscope. Answer. C. 47. Dash. Is an acoustic medical device for auscultation. A. Syringe pump. B. Flow meter. C. Euro flow meter. D. Stethoscope. Answer. D. 48. Dash is a portable device that measures and records heart's activity continuously for 24 to 48 hours. A. Echo. B. Nebulizer. C. EEG. D. Holter monitor. Answer. D. 49. Dash uses sound waves to create pictures of the heart chambers. A. EEG. B. ECG. C. A thalamuscope. D. Echo. Answer. D. 50. Which is the equipment used for opening patient airway? A. EMG. B. BP apparatus. C. Thermometer. D. Airway adjunct. Answer. D. 51. Cardiac stress test also known as A. ECG. B. EMG. C. Holter test. D. Treadmill test. Answer. D. 52. Scan is also known as computed tomography scan. A. Quartz scan. B. MRI. C. X-ray. D. Echo. Answer. A. 53. Refers to the set of mechanisms for straightening broken bones. A. Plastering. B. Surgery. C. Traction. D. Ventilation. Answer. C. 54. What is the color code used for carbon dioxide cylinder? A. Gray. B. Blue. C. Black. D. Red. Answer. A. 55. What is the color code used for nitrogen cylinder? A. Blue. B. Red. C. Yellow. D. Black. Answer. D. 56. What is the meaning of prefix noct? Nerve. Neuro. Nephro. Night. Answer. D. 57. What is the meaning of prefix hemi? Half. Double. Full. All of the above. Answer. A. 58. Which medical gas is being used for anesthetic functions? A. Oxygen. B. Helium. C. Hydrogen. D. Nitrous oxide. Answer: D. 59. Which gas is used for inflate tissues during surgery? A. Oxygen. B. Helium. C. Hydrogen. D. Carbon dioxide. Answer: D. 60. What is the color code for oxygen cylinder? A. Black and white. B. Red. C. Yellow. D. Blue. Answer: A. Thanks for watching. Please subscribe for more videos.